Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. The cliche about women who go to beauty salons is that they'll talk very freely to their hairdressers. Maybe they figure no one can overhear them with all those hair dryers going. But whatever the reason, the person playing with your hair often gets to hear what's on your mind. Can it go the other way? Will customers answer some personal questions and even take advice from the stylist? How about questions about their health? Here's Healthbeat's Jenny Passe Rodriguez.
I don't have high blood pressure, but I had what they call borderline cholesterol.
It was more than 200?
Well, I think it approached to 200. And so it forced me to evaluate myself and step back.
Not the kind of conversation you'd expect between a client and her hairstylist. But it's talks like this that health professionals at the Arthur Ashe Institute for Urban Health are trying to encourage.
A lot of women work 2 or 3 jobs, and when they come home and they're tired, the first thing you do, they just jump into the fast food restaurant and pick up anything.
We recruit salons that are interested in participating in the program. We train stylists to deliver heart health messages. And the way that in terms of our stylist training, we emphasize that stylists are natural talkers and they're natural at promoting health and being advocates and talking to their customers. So we kind of like teach the ABCs. So we want them we say A is for activity, remembering to increase activity. B is for blood pressure, lowering your blood pressure. C is for cholesterol, so you want to decrease your cholesterol. S is for smoking, and so smoking cessation. You want to also cut salts out.
If you're someone that's used to eating a lot of salt, salt is one of the things that, high blood pressure, contributes to high blood pressure. So you cannot eat very salty foods.
These health-conscious messages are all part of the organization's recent campaign called Heart of a Woman, aimed at addressing heart disease among African American women.
Cardiovascular disease continues to be the #1 killer of African American women, of people in general in the United States, and especially African American women, because we have high rates of hypertension and heart disease, and so we wanted to address some of those risk factors.
In addition to charts and health brochures placed in the waiting area of hair salons, like Women's Hair Care Center in Crown Heights, there is also a blood pressure monitor that customers can use while waiting for their hairstylist.
You're not pumping, you're not doing anything, you're just pressing a button. And then my blood pressure, 118/81. We have the chart up here, so you know what the normal pressure would be. We hope that women would follow up with their doctor, 1, and we hope, 2, that women would spread the word and speak to their friends, speak to their daughters, speak to their sons about cardiovascular disease, since it's something that's really impacting our community and is starting at a younger age now.
You're doing your hair, you're in an environment where you feel comfortable with the person that you're talking to, and them being able to give you some advice that could make you healthier, I think actually is the ideal place for it.
Even if maybe it's not dangerously high for someone to go to the emergency room, you still want people to follow up with a primary care doctor, and you want people to have the resources available. And so the stylists, they have what we call a resource guide with information that they can refer their clients to so that they can get follow-up care.
Also, if you're someone that doesn't exercise, then you might want to, start exercising to lower your cholesterol. Some people come in and you have very damaged hair. First, we can ask them, what is your diet like? Because it affects your hair. If they're on medication, I could tell they're on medication because, no matter how much treatment we give it, it comes out.
We would like to see change in knowledge about cardiovascular disease, but also change in attitudes towards, exercise and diet. Also, people being able to identify risk factors for cardiovascular disease, and also changing behaviors to address some of those risk factors. So we would want people to engage in more physical activity. We will want people to work towards lowering their blood pressure and lowering some of those risk factors, eating properly and changing their diets to accommodate better cardiovascular disease outcomes.
I know cost might be an issue, but what if they were to brown paper bag it to work to bring costs down?
Actually, yes, I'm gonna confess. It's an alternative. one I have difficulty achieving, but it is a true alternative. And plus, it's things that you prepare yourself. Right. You prepared it, you made the selection, and you get the opportunity to reduce the fat content and everything. So, yes, I shall keep that in mind as I continue on my journey, because I really am working on my cholesterol.
For Healthbeat Brooklyn, I'm Jenny Passe Rodriguez.
Download this program's podcast on iTunes. Keywords Brooklyn Independent Television.